20 minutes.
Okay, wow. It is so great to be here. I really appreciate this opportunity and to see so many familiar faces and organizations and to meet some of you or see some of you I haven't met yet. I am Sharon Meieran. I am currently the County Commissioner representing District 1, and that is all of the county west of the Willamette River, along with inner southeast out to Cesar Chavez. I am also an ER doctor. I still do some shifts, and I am a volunteer with Portland Street Medicine, where we go out to encampments of people who are houseless and provide a lot of stuff, including medical care and whatever people may need. I am I guess, recovering lawyer. I was a lawyer a long time ago, and that never leaves one, but haven't practiced that in a long time. And I'm the mom of 2 teenagers, live in Southwest Portland. My kids attended Portland public schools, one still does. And I also have experience providing medical care in a number of different places, just internationally, where I've worked in hospitals and clinics in Peru, in Arequipa, in Mongolia, and also in Cuba, in Havana. So that's a little bit about my background. And in terms of, all of that informs really who I am in my role as commissioner. It informs the policy work that I do. It informs how I sort of view this important role and the services that I can provide. And I do feel like right now, we have some multiple crises that are going on in our county, and there is a lot of inhumanity that I see happening. And I think most of us, especially in the work that all of you are doing who are on this call, most of us see some of this every day and, go to people's tents where people are living literally amidst garbage. People are experiencing mental health crises, and they are taken to jail by law enforcement instead of to treatment. We are seeing methamphetamine use that renders people psychotic, and we are seeing increasing gun violence and just escalating violence in our communities as we're all trying to emerge from this pandemic and the grossly disproportionate impacts that it has had on so many of our historically marginalized communities, people who are Black, Indigenous, other people of color, and we see these disparate impacts just magnified and highlighted. All of this during the pandemic, but this has been around since before COVID. And so, I do wonder, what's going on? How have we gotten to this point? But what's more important right now is what we're going to do about it, because I know that we can do so much better than I think a lot of people. I mean, this is, again, it's really great to be talking to this group, because I think you and I all see the hope that is there and the opportunities and the potential to be coming together to move forward. So I am running for chair because as a sitting commissioner, I have learned a lot about the different roles at the county, and I've learned that the chair really sets the vision and direction for the county. And there are some areas that I believe we need to be paying particular attention to right now and focusing on, so we can get through and have better systems in place that can both address current crises and also move us through the long term. So for me, this role is really about public service, and it's about the county's mission, and it's about doing the work. And when I think about it, all of my experience has steered me toward this as a culmination in terms of public service. And my priorities are what they always have been, which are houselessness, behavioral health, so mental health and substance use disorder, along with public health and safety. And in my work as an ER doctor in particular, I've learned not only a lot of the elements about dealing with these issues at a substantive systems level, but also about how to triage it all as it's all coming at us at once. And so I feel like it's the moment in time that is calling for the unique skills that I bring. But it's, I always bear in mind that the role of chair, although it has that power, the ability to set the vision and the direction, it is not, and it should not be an autocratic position. The key is how that role is used and engagement with community, and it's not about a single person. And we are just fortunate. I'm on an incredible board with wonderful people who I work with well and respect. And we have incredible employees at the county, and we need a culture of openness and inclusion and listening to be able to elevate those voices and support people in doing this service. We have a tremendous array of organizational partners, all of you who are here, who connect with communities on the front line and have those trusted relationships that we need to be partnering with and supporting as much as possible, and building on that so that we can do our work together collaboratively and effectively. So I'm going to mention some of my priorities, some of my plans very briefly, because I really think the key is having the conversation and answering any questions that you might have. So, in terms of the issue of homelessness, there have been challenges for a very long time, since long before the pandemic. And I think that there were some roads we could have taken during the pandemic to maybe have not sort of let things get to a point that they got to. But we are where we are. And my philosophy is always, okay, here we are. What is the reality and what can we do to move forward? And this question to me, and maybe it's because of the emergency physician perspective or seeing people and talking to a lot of people living outside at encampments, it really has to do with what I feel is a true humanitarian and public health and public safety and individual health and safety crisis that has existed for years. And we need places where people can be safer and healthier, and places that they would want to be, that can establish, like, I guess I think of it as a first rung in a ladder. The places they can feel safe enough, can be secure enough to not feel traumatized and worry every night that they're going to be swept, that kind of thing, that they can finally breathe and connect to all of the incredible services that are in our community. So I think that needs to be a very first step, and we need to be investing resources in that work. And I do have a plan. I've put it on my website. I'm kind of honing it right now, so I'd love input in that. But what it adds to our current system, I feel we clearly can't use a one-step-fits-all model to address houselessness. So, and that includes first shelter as well. What's beautiful is we need places people can go that they want to go. And in talking to people, kind of came up with the concept, and this was not alone by any stretch of the imagination, but the idea of a system solution. So adding some components to what we have. And the first would be a network of like really tiny sort of micro nano sites. I don't even know what to call them, but like across our county, equitably distributed tiny impact sites that are like 10 structures where people can live and have that sort of shelter, safety, security with basic amenities that we need. Toilets, hand washing and hygiene stations, laundry services, trash pickup, and then maybe a peer who's living there, whatever, some basic support. And we help people identify places they would want to go with community, with their stuff, with their pets, and we help people get to places. Also a network of safe parking sites where people could be. And then when we talk to people and are trying to establish relationships, when we're saying, we know you don't want to be on the street. I've yet to meet someone who says, I really want to be living on the street right now in this condition under the tarp. And when we talk to people, okay, well, where would you want to go right now as we work toward housing or those longer term solutions? Then we help people get there. And if we had like even one of these tiny sites, like not safe rest villages, not the big things, but one of these tiny sites in each neighborhood in Portland, say, that's 1,000 people who can be in a healthier, safer, better condition that they would want to be in as we're working toward longer term solutions. And then it gets to that other concept we need to address, which is sort of coordination of the outreach services so they can be, so all of the people who are out there, many of you on this, at this meeting, can be effective in having those relationships that are so essential to getting people the services and housing and supports and case management that they need to thrive and to go to the next steps. And so that's kind of something that I think about a lot, and I would be interested in getting feedback on that, but it allows us to create a baseline of safety and health that I feel is missing and is essential. And the other element, and then I think some of the longer term work, we need to do more of it, continue with long-term rent assistance, prevention to keep people from becoming homeless in the first place. So, all of the things that we are currently doing and can facilitate and systematize so that people can be successful in moving through a healthy pathway, a pathway of some sort to ultimately get to the housing that they need. So anyway, homelessness, I don't even know where I should, sorry, I don't know if I moved it a little bit aside. I don't know where I am. I'm just going to talk and someone will, I imagine, will stop me. So my other issue that is my passion and my priority is behavioral health, and it's mental health and substance use disorder. But one of the things that I see in the emergency department, have had personal experiences, family experiences, is we just don't have a system of behavioral health care that effectively supports people and provides the services they need when they need them in the way that they need them. And I've been doing a lot of work in this area, and we need urgent solutions and we need longer term systems transformation solutions. I'm working in both of those arenas right now. And urgently, in terms of, say, Blanche House, there are organizations, again, on this call that we collaborate with that have really great ideas of how services can be provided and what would truly be helpful working with people in the real world. And what we need to do as a county is partner effectively in implementing some of those solutions to say, what would help? Like, even before we need de-escalation, why don't we have people who are outside, who are at our organizations, who get to know people, so we don't even get to the escalation point where we need those services. What can we have in our community that supports people being in places like, respite, living room models, peer-driven solutions that support people where they are. We have a crisis with youth mental health right now, and I am I'm sort of sponsoring and facilitating what is really a youth-driven youth mental health forum at the end of May. And this is just bringing together kids who know what they're going through, understand what they're going through, have really exceptional ideas for solutions, are really courageous in raising their voices and bringing people together to say, okay, how can we empower you to bring about the solutions you know will work for you? So we need to be doing that kind of work in behavioral health. There's a couple of facilities we're working to fill some major gaps in our continuum. Behavioral Health Resource Center. It's a county thing, and I think many of you are probably aware of that, could go into detail on that. That's downtown, and it is respite, it is behavioral health focused shelter, and it is sort of bridge housing for behavioral health needs for people coming out of institutions or other settings where they need stabilization and can be, so that they can get onto a better trajectory and hopefully connect to housing. Behavioral Health Emergency Coordination Network, all the same letters in the acronyms are pretty close. That's another thing I'm working on with our health systems partners and CCOs and a number of folks in the behavioral health system to triage crises where people can go. That is not, if you're in crisis right now, you go to an ER or you go to jail. Neither of those places is a good place to be in crisis. And where can we provide what people actually need that can help them stabilize, triage, and again, get them on a better path to get treatment, housing, the things that they need, and get them connected. Working on that effort as well. And so these are the kinds of things, this is where I know these systems. I work with people on the front line who are providers. I work with people who are users and consumers of our systems. And I see how it all fits together into a meaningful whole, and where we can all be working together to impact those systems so that all of us in our community benefit. Right now, these systems are where we're in crisis. They're the systems that are the core function of the county. We're the local mental health authority, local health authority, board of health. They are my areas of passion, priority, and expertise, and always have been. And at this moment in time, having that knowledge, dedication to these issues, relationships, experiences, solutions, plans, that's what we need right now. I'm running against my two fellow commissioners who are fabulous, and they're, I'm so excited. In whatever capacity, we will continue to work together for the next almost 3 years. But I think in terms of the direction of the county right now, it's a specific skill set at a specific moment in time where we're facing some of these core issues. I'm going to just stop there and then hopefully just be able to answer some questions.
Okay, sounds good. Well, thank you, Sharon. Now we'd like to open it up for questions and answers. So please either enter your question in the chat or you can raise your virtual hands.
Let's see if I can find the chat. And I'm sort of scanning, so please tell me if
I will unmute whoever
okay.
raised their hand or wants one in the chat. And we also have some pre-submitted questions. So we will go ahead and get started with one of those.
Great.
How will you work to ensure true mental health and disability needs are being addressed in Portland Metro?
That is something, again, has been a core mission of mine. I mean, it's really why I ran for county commissioner to begin with, because the county is the local mental health authority. And I thought, oh, I've seen a lack of so many of these systems and supports we need, and people are falling into crisis. What can we do? And I'll get to the county and I might be able to tweak our, I'll make it all work better. And when I arrived at the county, I discovered that there is not a functional mental health system. And this is not saying anything against any individual person or people or anything. It is from decades of disinvestment. It is from lack of prioritization of this work. And so kind of starting with the idea of, okay, what does a system look like? What do we have and what do we need and where are the gaps? So I sponsored a deep systems analysis that focused on people using the system and what they needed, and people working in the system and how they perceived the system, and had town halls and engaged with lots and lots of providers and people with lived experience. And this analysis came up with a number of recommendations of how we could make our systems functional. And there are some great recommendations. There's some major ones, which is number one, like create a vision of what an actual mental health system would even be that is shared in the community. And then, develop ways to coordinate and do all these things that a lot of us know need to happen in a system. And then some very specific recommendations. But key to all of it, sort of some themes that flowed throughout were the need for housing with behavioral health support, tremendous need, workforce support and development. So we need to, it's money, but it is so much more than that. People are working in some of the most challenging conditions and need supports to do the work. We need tremendously desperate need for culturally specific providers so that there are opportunities for people in our historically marginalized and most underserved communities to have actual mental health support, and deep expansion of the peer workforce, so which can be throughout. But my goal is, as chair, actually would have the power, the authority, the convening power to pursue this in a meaningful way and finally develop holistic systems that provide the services people need. And I would hope, as chair, I would have an opportunity to work with all of you and the people you work with to make that kind of system a reality.
Thank you. So does any participant have a question? Please raise your hand or put it in the chat. If not, I will move along to one of the other pre-submitted questions. Okay, it looks like we have one from Andy Miller. So can you share whether you support People for Portland's ballot measure that would require Multnomah County to divest resources from housing programs and invest instead in expanding the number of shelter beds? How do you feel about the proposed enforced shelter provisions, which will mean people who refuse to go to shelters could face criminal sanctions?
Thank you. I'm so glad you asked that question. I was actually going to just sort of spontaneously ask it and respond to it myself anyway, but it's great that you asked it. So I do not support the People for Portland or whatever People for Portland ballot measure. And it is because of the two things you mentioned in the chat. It is not in my mind, it is not appropriate to have any kind of an arbitrary breakdown of, let alone the 75%, but I don't think there should be any arbitrary breakdown of what goes to shelter, what goes to housing, because for me, the answer is a true continuum. It's about the pathways and getting people into the housing. So for me, that's a non-starter. And then also, I've been very clear publicly forever that I do not support sweeps. And so there's no way one of the reasons that I have proposed the measure I have proposed since long before People for Portland ever existed, with like the safe the tiny sites where people can just be, is because that's what people have told me they would like to see. There are things we can do urgently for less money in an effective way that can get people things that they would like to see, that they can be safer and healthier. We shouldn't be in no way criminalizing people or subjecting them to sweeps in order to achieve these. And the thing is, we don't, if we did some of these the things that I think could be win-wins, we wouldn't need to be even having that conversation. So rather than sort of demonizing each other, criminalizing and not, I just feel like, let's just be doing these things that people want to see, that are more effective, that are safer and healthier. And then, after that, evaluate. And I think we'll be in a very different situation. And that's just not even a question. But the short answer is no sweeps, period. It's inhumane and doesn't solve anyone's problems and is a waste of money. So.
Okay, and I'm going to pass it over to Brandy to ask her question.
Hi, Commissioner Meieran. It's good to see you. Of course, I have a question about trauma-informed shelter. So, so brain science, we know that through brain science that when people don't have shelter, they don't have the base of Maslow's hierarchy of needs. They don't have access to the part of their brain that governs critical thinking, logic, rationality, all that good stuff that helps you get sober, get a job and keep it, apply for housing, follow through on a disability application. And we know that unless they are intensely trauma-informed, shelters can exacerbate this experience and keep people in survival mode. So how will you ensure that the neighborhood-based programs are trauma-informed and actually help people access that part of their brain they can use to get out of homelessness back into housing?
Well, I think, first of all, thank you so much for that lovely description of that, why that trauma-informed approach is so essential. And I think that, I go to Maslow's hierarchy of needs a lot, and trauma-informed approaches. And where I believe that we would be starting in those, sort of the neighborhood sites it's kind of a harm reduction model that is literally getting people a safe sort of roof and a place for basic needs to be met, and security, and an ability to sort of sleep. The services in that model would be provided by organizations that currently provide services to people who are living outside, unsheltered, and that will engage in outreach. And so but the thing is that it would enable those models where people are already living outside in those situations. It would provide those opportunities to connect and provide the trauma-informed approach reliably and consistently with people and meet them where they're at. So it's by no means like the epitome of what, if only we could just have everything that is the right thing and everything could be like your facilities, for example. But it is better, and it is safer and healthier, and can start what hopefully will be the process of getting people to each level of those needs to meet them where they're at. And so I guess that's where I would start.
Thank you. And then we're going to pass it on over to Andy Nelson.
Hi, Commissioner. Thanks so much for joining us today. I'm Andy Nelson with Impact Northwest, and I'm glad we're talking about really specific solutions to strengthening our social safety net. Of course, that is of prime interest to all the great organizations that are hosting the forum today.
Yeah.
But we all have a really similar problem. I think you know where I'm going with this.
Yeah.
That if we're going to build solutions that work, we're going to have to invest in our nonprofit social service workforce. And as you know, we are not able right now through county contracts to pay our employees a housing wage. They're having to spend a far disproportionate amount of their take-home pay on housing. However, folks that work with directly for Multnomah County do make a housing wage, and that's only right. And I know you're aware of this issue. We've talked to you about it before. As county chair, what can you do to make sure that we have equitable pay for the people that are going to be on the front lines of this work?
That is one of the things that is of utmost importance to me, because again, if we are not supporting our work, like the people doing the work on the front line effectively, then I mean, we need to walk the walk to support our workers, to support the people that we are, our mission is to serve. And it has to be a both and. And I know I've engaged with you, and I have wanted to address this since, I mean, when I first started working at the county and kind of learned of this little bit of a different hierarchy, or however you want to describe it, like that's it. It's not right. It's not fair. It's not that can't be the system on which we are built, and we need to revisit that system. And I believe that we need the starting point we have to work from is, okay, what does it take to support the people doing the work, and then build from there. And that has been something that as I have engaged with you and a number of folks that are on this at this meeting, the chair's office has actually stepped in to say, we're working on this, it's kind of a, we're negotiating it, we're figuring things out. And it's not your role as a commissioner to be, to kind of be doing that. And where I see the opportunity, one of the many reasons that I am wanting to be chair, that I'm sort of putting myself out there for this position, is to be able to drive that work inclusively with my fellow commissioners and with you to say, okay, where do we go? How do we build the system? Because it is essential. Like we can't move anywhere unless we're doing that. So priority, collaboratively, those are two words I would just use, and would love to continue that conversation.
Please feel free to put any additional questions in the chat. And then next we have one from Laura.
Hi, Commissioner Meieran. Good to see you. Thanks for being here today. I wanted to ask you about the 3,000 challenge and what what your position is on that. And for all of the group here, the 3,000 challenge was created by a group of social service nonprofit providers and organizations as a way to highlight that housing could be provided for 3,000 folks in a way that would be much quicker and more substantial than providing 3 ginormous 1,000-person shelters. So that's where the 3,000 number came from. And the goal is to achieve this by the end of December of 2022. So I was hoping you could share with us your thoughts about that activity and proposal, and let us know where you stand on that. Thank you.
Yes, thank you so much, Laura. And so first of all, let me just say I will never support, I would lie in front of the bulldozers, whatever those, 3 ginormous 1,000 per, that I just let that one die. It's natural death. But for the 3,000 challenge, I mean, I love that. I think it's a great concept. For me, I've asked the question of, I mean, isn't this in some ways a lot of what the supportive housing services measure is meant to do? Is people who are living outside, unsheltered, many of them, let's get them into supportive housing. And so like, that's why I signed on and advocated for the measure. So, I mean, I'm all behind that. I have talked to some folks to ask to have a meeting about this, and have been informed like that it's, that the group has met with Mark Jolin and the leadership at the county, that with others, and they can't, like, that I was sort of advised that there wasn't a meeting that I would love for anyone who's out here who's involved with that process. I would love to have a meeting or conversation to talk about what the realities are and what it would take, because yeah, that's exactly what we should be doing, and I feel like we should have been doing for years. And so how can we make it happen? And I feel that's where the SHS measure, at least, a large portion of it, where some of that funding should be dedicated. So yes, let's talk about that, and anyone else who wants to be part of that, because whatever I can do to make it happen. I don't know why we aren't or haven't.
Thank you. So another question, what will be your approach for leading initiatives to ensure the safety and well-being near and around Portland area schools?
In terms of, could the person who wrote the question, is there some clarification around that? Like what particular type of safety, or, I mean, I hear so many things around schools, whether it's people are using drugs, whether there's violence, whether there's gun violence, whether there are discarded needles, like there's a whole range of things. People who are houseless living by is there?
So that was actually a pre-submitted question, but I would
Okay.
welcome any participants if you have anything you want to add to that to raise.
I mean, I can answer sort of broadly. This isn't going to be the most specific solution, because there's so much there. But what we need to be doing so much more of, in my book, is collaborating and communicating with our schools and with our, our PTAs and the communities around schools, because the county and our school districts, I mean, we have so much of an overlapping mission. We serve some of the same people, we face a lot of the same issues, and there's so much potential and opportunity for collaboration that is going from what I have seen, unrealized. And so I would want to understand the specific issues to be able to work on more specific solutions, but it would be through engagement and community partnership.
Thank you. Then another one was submitted by someone who lives in the Roseway Madison neighborhood, and there has been 4 gun-related deaths in 8 months and even more shootings. So what is your position in the current gun violence and homicides on 82nd, resulting in divestment of local businesses in the neighborhood and safety issues for youth who attend McDaniel High School?
It's a McDaniel. That's also where the fentanyl overdoses happened as well. It's truly horrifying what is happening in terms of the gun violence in our communities. Like I mentioned, I have two teenagers, and they're in the public school system, and they have both told me that, like, the first thing they do, like the first thing that crosses their mind when they go into their class, when they go into anything, was, okay, if there's a shooting incident, where do I go? And it's shocking and necessary, and particularly in certain neighborhoods and areas. What we need an work to be done immediately, and then we need the longer term work, and we need, what are the words? Sorry, my words are failing me right now, but we need both the upstream sort of solutions that we're implementing to address root causes of violence, that there are a number of individual programs in our communities. We need the responses to violence when they happen urgently. And as an ER doctor, I've been present at way too many with incidences of gun violence, and where I pronounced young people dead and had to inform their families and loved ones. And so we need systems in place to address the trauma that is experienced and the trauma in the broader communities. So, counseling and support and outreach. And what we need to be doing in real time to address gun violence is the kind of investigative work that can figure out, who has guns that shouldn't have access to guns. I mean, the emergency protective orders for people with certain mental illness and have the potential to be dangerous to others. Like, there's some things that we need to work on enforcement to get guns out of, where we have tools to get guns out of the hands of people who can be violent. And then we need to be doing the investigative work of, where do we find the sources of guns, and figure out who has them, do seizing of gun. Like, it's an entire continuum. The county does a lot of that work from the upstream standpoint. And I think that it's essential that we really lean in and invest in that work at all levels, like with our schools, with our community-based organizations and partners. And we need to be doing much more to, and I don't know, I wish I had the answer. If I had the answer to that, that would be really wonderful. But we need to be investing in the actual solutions to cut off, the root causes, and get guns out of the hands of people who shouldn't have guns.
Thank you. And we have one question that just came in through the chat, and given time, this might be our last one unless others have additional ones they want to add. So there seems to be a rift between Multnomah County's approach to addressing our housing crisis and the city of Portland's approach. As county chair, what would you do to foster collaboration between our 2 local governments?
That is a great sort of final closing question, because it is so important. We need collaboration at all levels. And so I think so much of the disconnect is around what feel like they're competing sort of visions. But the reality is I've seen this more at the leadership levels of the city and county. And the reality is, I know that I do, and I feel probably my fellow commissioners have really exceptional relationships with the city commissioners right now, all of them. And we are a lot more aligned in our visions than I think is like portrayed in the media. And there are so many opportunities to come together. And what's really important, I've done a lot of work in this and fostering those relationships, is having that opportunity to truly share in a vision of sort of an ecosystem, like where we want to be. And we've just missed that. We don't have that unifying vision. And so it's hard to work toward it. And then you have maybe some personality. I'm not going to say anything, but maybe you have some that might be kind of throwing things out there like, oh, and then there's this thing. And then, we hear these things. And I think that is doing so much damage to what can be a really collaborative relationship, and what really is a collaborative relationship. So we need to be together. And so I would be engaging with an unprecedented communication with city colleagues and East County colleagues, frankly, and bringing people together to share that vision and that work. And I don't have it with me now, but I created a graphic. I think it's on my county website, but a graphic of the structure of our systems between the city, county, and what the homeless structure is right now. And just structurally, it makes it almost impossible to have some effective collaboration, but kind of having it all written out there and to have a picture of it. It's like, oh, we need to lean in here and figure out how to break down some of those barriers and work on that together. And I sense so much desire on the part of city commissioners as well to do that work, break down barriers, work together, share vision.
Okay, thank you. And any final questions before we open it up for closing remarks? Okay, so Sharon, do you have any final words you'd like to share with the group?
I want to say thank you all for being here. This is an incredible group, and I just appreciate the work you're doing in the community. As chair, I would just foster relationships and would want to work with you to just move our county forward. There's so much, I have so much hope. I see so much potential, and together, I think we can just literally move mountains. So, and feel free to reach out to me if there are any questions that you have that weren't answered or you want more information. I'm very easy to get hold of, and I truly do have an open door and want to hear from you. So please feel free to reach out.
Okay, thank you everyone for joining, and thank you to Sharon Meieran for giving us the opportunity to hear more about your position. We will make sure that a recording of this is available following the cafe, and I hope everyone has a great rest of your day.